Well, good morning, everyone. Can you hear me? It's kind of noisy back here with all this construction. Welcome. I am Greg Fenves, the president of the University of Texas at Austin. First of all, I want to thank Seton for clearing out the parking garage at the top level and giving us this wonderful site with this incredible view behind us. Before we begin, I'd like to recognize a few special guests that are here today. From the University of Texas system, we have the Executive Vice Chancellors, Dr. Ray Greenberg and Dr. Steve Leslie, Health Affairs and Academic Affairs. One of our partners is Huston-Tillotson College here in Austin, Huston-Tillotson University, and I'd like to recognize President and CEO Larry Irvin for his distinguished service as president of Huston-Tillotson. And starting Wednesday of this week, the new president of Huston-Tillotson, Colette Pierce Burnett. Colette, please stand up. And of course, another major partner are the citizens of Travis County, the Central Health District, and I'd like to recognize the Central Health Board members who are here today. So please hold your applause until I recognize all the members, and please stand when your name is called. Tom Coopwood, Katrina Daniel, Sherry Greenberg, Lynn Hudson, Cynthia Valdez, and Kirk Kirkendall. Please recognize our Central Board. Well, we've asked you here this morning to celebrate a very significant milestone. Today, I'm excited to announce the Dell Medical School has received preliminary accreditation as a medical school. This means that starting today, we will begin recruiting our first class of medical students to be here just a year from now. This accreditation from the national organization, LCME, Liaison Committee for Medical Education, was a very rigorous and thorough review of the entire medical education program, the medical school, and the university and our clinical partners. And so we are very pleased to have this major milestone achieved for the Dell Medical School. Now, a research university like the University of Texas at Austin, building a medical school literally from the ground up, as you can see behind me, started with some concepts. The concepts about how we're going to rethink medical education, research, clinical care, and delivering value to patients. And we took those concepts and created an organization. We created partnerships, and yes, we created the over 1 million square feet that's under construction between the University of Texas and our partner, Seton Hospital. It really is a unique venture in American higher education and American medicine. It combines the resources of a top research university with fresh and unfettered thinking that will allow us to examine every assumption about medical education and healthcare. And it is truly exciting for all of us who have been involved with it, and it will be truly exciting to the citizens of Austin and Travis County. Today, there are 143 medical schools in the U.S. We did not set out to build just another medical school, number 144. We wanted to build something unique. Through excellence in medical education, and this will be a truly transformational program for our MD students, how we translate research from basic science to patients and making them better, to clinical care itself and delivering value and quality to patients in our region to improve the health of Austin and Central Texas. So today I thank the many partners that have been involved in this endeavor, the leadership of our city and our state and our county that have made this possible, and the Board of Regents of the University of Texas system that made major investments along with the citizens of Travis County. This will be an enormous boon to our city and to our region. And as I said, I can't wait for the next milestone a year from today when we greet our first class of medical students at the Dell Medical School. So finally, my job as president is to make sure that we get the best people on board to actually do the work. And we cannot have a better leader of the Dell Medical School than the founding dean, Dr. Clay Johnston. So I'm going to ask Clay to come up here for some more remarks. Thank you very much, and congratulations.
Thank you, Greg. That was perfect. Really appreciate it. I can't help but notice the symbolism here. So, you know, all us speakers, we're up here in the sun, sweating away, and we've got all of you all nicely situated in the shade. And that actually, both the glow of the sun, but also the heat and the sweating of the sun, there's something that was an accident, by the way. And I'm not necessarily appreciating that accident right now, but it's still wonderful to see. 2.5 years. 2.5 years. So of course the initial work to think about the med school, I mean, it goes back decades. A lot of really hard work by a number of you started to happen 3-4 years ago. But 2.5 years, that's when it was clear that Austin was going to have a med school. That's pretty amazing. That's not long ago. And that was it could have gone either way. Of course, it dramatically went to having a med school. But at that point, 2.5 years ago, none of any of this was even probably in people's minds dreamed to have been possible in 2.5 years. A year ago, we were at the same site across the street. And it was basically a parking lot and not much else. And then 3 months later, we were back, and it was a little better than more mud, but just a parking lot. But look at it now. It's really, I can't believe how big these buildings are, too. When you look at the plans, they just look like a few rooms, and, are we going to run out of space? And then when you look at these buildings, I can't believe that we're going to fill these with people. But we will. So the fact that the community brought us here is one of the things that makes us so special. And yeah, we're not number 143, or is it 144? Yeah. We have a much greater responsibility to be something entirely new, to be number one. Not number one in a traditional way, but be number one in thinking about how to do academic medicine better. This additional, important, monumental step today of announcing our accreditation is getting us closer to that. So what is a medical student? What are the kind of medical students that we envision having here? Well, this is a big challenge. We're not just here to train more docs to work in our clinics. Yes, we need that. But we really need leadership right now in healthcare to get us to a whole new level. Not just in healthcare, but in health. We need to get out of the hospitals and keep others out of the hospitals. And that means re-envisioning, too, what a medical student should look like. So our medical students need to be totally driven to make changes, creative, leaders, because they're going to have to bring along others with them. They're going to be smart as hell, but they need to be great people. So those are our aspirations for our medical students. I'm pleased to tell you, and this is a little strange, we already have over 1,000 applications. It's a little strange. Here we are announcing this morning, but we had to flick a switch on the admissions pages. Actually, it was just last week, right? And in the last week, we've had over now 1,000 applications come in. So it's already nearly impossible to get in to Dell Medical School. But I hope that won't dissuade anyone from applying. So more broadly, we have a big mission here. And we can't do this without really strong partnerships and strong leaders. And so the way we designed this morning is to have you all hear from some of our key partners, some of our key leaders within the organization who are going to tell you about how we're rethinking various aspects of this mission. And with that, it's my great pleasure to introduce you one of the most important leaders who was here well before I was, and that's Sue Cox, our Executive Vice Dean for Academics. So Sue.
Thank you, Clay, for that lovely introduction, and Greg for your comments. This really is a monumental moment when we get to rethink education. By rethinking education, we've created an educational program from scratch that gives us a huge opportunity to bring together the most creative and effective current teaching practices and to add many new innovations to the curriculum. In Rethinking Education, we've designed an educational experience that will prepare our students for the opportunities and challenges of modern medicine. Rethinking Education will allow Dell Medical School not to train just doctors, as Clay alluded to, but to train the physician leaders, people who are comfortable taking on transformational health challenges as they are caring for patients. Every part of our curriculum is calibrated to focus students on the challenges of 21st century health and medicine and to engage their creativity in solving those challenges. In Rethinking Education, we have placed an emphasis on education that is more individualized and more self-directed, stressing learning rather than teaching and memorization. We will also expect students to help chart their own paths to success and leadership. There are several things that make our curriculum unique. Here are three. Number one, the Innovation Leadership and Discovery Year includes options for students to individualize their education. They can perform traditional research in the student's field of choice or pursue a dual degree. During this block, students will select a project in one of three initial areas: population health, care redesign, and discovery or translation. Number two, our signature integrated interprofessional activities will be incorporated throughout all 4 years so that the medical students will learn with interprofessional students from pharmacy, nursing, nutrition, and social work, among others, during their time at Dell Med School. They will tackle health issues in teams and work in the community on meaningful and impactful projects. Number three, the longitudinal training in primary care settings will complete a 2-year clinical experience in preventive and community medicine where they will work with faculty in our local community-based clinics caring for the residents of Travis County. Not only are we rethinking education, but Dell Medical School is also rethinking the role of academic medicine in society. With our curriculum as a map, our world-class faculty as guides, our charter class of students will be the future physician leaders to blaze a trail for Travis County and the world into the future of healthcare and medicine. Thank you. It is now It is now my honor and privilege to introduce a dear colleague and friend, someone who needs really no introduction. He's the man with the vision. He had the vision for the med school. In July of 2011, I was summoned to Senator Watson's office and told, I want to build a medical school. Help me do it. So without further ado, our past mayor of Austin, our Senator Kirk Watson.
Mr. President, Dean, friends, Austinites, and folks from Travis County that have been so much a part of this, this is our chance to rethink innovation. When the nation looks at Austin, Texas, it sees uncompromised creativity. It sees a formerly college and state government small town that's today an enormous creative crucible, a place where possibility means pushing boundaries and openly deviating from the norm as far as inspiration allows. Our home is a magnet for innovators who possess weird or different ideas that are capable of changing the way people live and view the world. That innovation found its fullest inspiration and expression when this remarkable community voted to create a new medical school at the University of Texas at Austin. Now, the innovation flowing from this medical school and the vital, inclusive health ecosystem growing all around us starts becoming synonymous with Austin. The Dell Medical School offers boundless possibilities for a healthier community, economy, and world, and the innovation stands at the center of each of them. With this school's preliminary accreditation and all that it allows, the world will see these possibilities for itself. The world will see what happens when you team the brilliant people building this school with the creative community supporting it. It will watch the Dell Medical School accelerate innovation from the moment of discovery to the ultimate delivery of products and procedures that improve health here and everywhere. And the world will see what happens when the innovative city of Austin, Texas, rethinks innovation and then puts it to work creating a healthier home and a healthier world. Watch this video with me.
How do you keep an entire group of people, an entire community, as healthy as they can be before they ever get sick? What's the role of a med school and academic medicine in a community? How should we be designed? The healthcare system's so broken. The reality is this is all about patients, about people. It's about being able to provide better care for people. It's really time to revolutionize the way that people get and stay healthy.
I think we need to rethink engagement.
We need to rethink primary care.
The way healthcare works or doesn't work.
How we teach.
How we include everybody in the community.
How we learn on the job.
Role of technology.
Access to healthcare.
Prevention of disease.
Healthcare teams.
Medical education.
Care for chronic diseases.
Hospitals.
Quality.
Medicine.
The patient.
We need to rethink everything.
This is a unique opportunity to build a medical school at a major research university from scratch.
The University of Texas at Austin Dell Medical School is the first in the last 50 years. That's an extremely profound situation.
It's not starting with a whole bunch of assumptions that were generated 100 years ago.
We're starting with a blank sheet of paper. This really comes down to figuring out how we're going to build a medical school for the 21st century.
There's no tradition, no expectations about the curriculum and what must or must not be in it. We have an opportunity to really get it right and rethink how to build a med school, how to build academic medicine.
It's getting away from the kind of classroom approach to teaching. How much more hands-on do the students get?
It's going to be an incredible opportunity for Dell Medical School to leverage those parts of the campus that will allow us to develop new ideas, new strategies.
We're building a really interesting team that are coming from an engineering and artistic background or industry. Having people that are coming from entirely different perspectives makes it more likely that we'll find creative solutions.
What is the cutting-edge research that's happening across campus? And how can we expose that research to the industry that exists already so that they can then accelerate its movement out into becoming a real health product?
We hope there's a whole innovation district around us, whether those are biotech or digital health, entrepreneurs.
Leveraging the full strengths of academia with the full strengths of industry so that we have people that think very differently coming together in new kinds of teams in ways that we haven't seen before.
I think that the healthcare changes we will see will be phenomenal. And they won't be healthcare changes just located in a building that has the word medical school on the side of it. They will be healthcare changes in communities that have been underserved previously.
Solving healthcare really starts with people, and it starts with understanding their needs first.
We need to be thinking about the patient anew. Let's think about how should this experience be designed? What are their critical issues and how can we address them? Is it a technology? Is it eliminating the waiting room? Is it having the refills show up automatically at their home? Whatever it is, thinking about it from their perspective, that's where the real solutions are going to come. It's not about looking at how healthcare has been. It's not even about where the healthcare system is today. It really should be about the healthcare system that we want.
We envision a vital, inclusive health ecosystem, one that keeps rejuvenating and asking what's the next problem that has the next solution and keeps evolving.
The system has to involve the people who are affected by the health problems working to make those changes.
The Dell Medical School has the opportunity to re-envision the way care is delivered in an entire community.
The community is the team.
We wouldn't be able to start the Dell Medical School without our partners. For example, with Seton and Central Health.
We are hiring world-class faculty. We are going to build world-class facilities. And so this is a strategy for long-term success.
We have the opportunity to really create a new culture of professionals.
Folks that are really thinking about how to creatively solve the big picture problems in health.
The Dell Medical School is looking to create a different kind of physician. There'll be team players.
They will have strong leadership traits.
Experts who are excited by what they're doing, who are passionate about developing new ideas for healthcare and research.
A community of innovators who are willing to think outside the box. And the Dell Medical School can be a place where we can make those ideas real.
Really, we're about being an entirely new type of medical school and taking an entirely new approach to academic medicine and driving forward Austin as a model healthy city.
Good morning. My name is Chris Vasquez, and I am the president of the new Dell Seton Medical Center at the University of Texas. It is a great time to be in Austin, Texas, and I want to start off just by thanking Senator Watson, the leadership of UT, and everyone that had the vision to create what's going on right behind us right now. When Senator Watson was up here, I don't know if you noticed, but one of the cranes started moving. And I was sitting in my chair saying, okay, and now another crane is moving. There's such a level of collaboration that goes on with the cranes that are creating the buildings behind us. The same thing is happening within our community. And so this is our opportunity to rethink care. Under construction behind us is the new Dell Seton Medical Center at the University of Texas, and that is a long name. But each of the words in the name have significant meaning. So Dell, it really speaks to Michael and Susan Dell, the foundation that they have and their commitment to our community. Seton has been involved in and committed to this community for years. We also are very committed in our mission within Seton to serve the underserved and those that are the most vulnerable amongst us. Center represents the centers of excellence that will be provided in this 21st century academic medical center that is going up right behind us. The University of Texas, this really references all the academic work that has been going on at the University of Texas for years. And now with the new Dell Medical School, we'll be able to bring a level of research that currently doesn't exist in our community. One of the marvelous things about this project is we bring together the medical school, the academic teaching hospital, the nursing school, the social work school, the pharmacy school, the engineering school, and the business school. We can continue to go on, but we will have a level of collaboration among many disciplines that will exist on this campus, and we will work together to drive care to the next level. Rethinking care means the Seton physicians can work with the Dell Medical School and bring research right here to Central Texas, right here to Austin, Texas. And that'll benefit those that live here locally because they'll be the first to receive that level of care. And most importantly, it means that Seton and the University of Texas could work together collaboratively to serve those that are at the center of everything we do, our patients. It is my pleasure now to bring up Larry Wallace, the Chief Operating Officer for the Central Health, one of our major partners.
Good morning. It is a pleasure to be here, and I'm pleased to represent Central Health, our Board of Managers, our staff, our President and CEO, Trish Young-Brown, who's out of the country, but her thoughts are with us on this morning. And it is a privilege for us to be a part of this endeavor. We believe we represent the community, and Central Health took a chance and really asked the community, following the leadership of our Senator Watson, our leader in the 10 and 10 plan, and we took a chance and asked the community to trust us with an investment. Prop 1 is what it's called, and you know the end. And because of that, all of this is going on behind us. I really don't think without the community, it wouldn't be happening. So we applaud the community. They're not here today, but they will certainly reap the benefits of all of this work. Rethink Health. We know that the current healthcare system in its past state and even in its current state will not meet and serve the needs for our future requirements. Healthcare is expensive and complex for providers and those that seek to use it. Central Health is focused on transformation of healthcare. Not just more health care, but transformation of health care. By taking care of people before they become seriously ill and needing the emergency room as their only method of obtaining health care. Such words that you'll hear coming from our medical school partners is population health, health and wellness strategies. We know that these are really necessary if we're going to have an advancement and transform healthcare. In 2012, as I said earlier, the citizens of Travis County voted to support the creation of the Dell Medical School. And today's announcement is the next step toward keeping our promise to improve care for those who need it most here in Travis County and making this a model healthy community. The Dell Medical School and the new Dell Seton Medical Center at the University of Texas will improve health care for low-income and vulnerable residents of Travis County. We will use models of integrated care. An example is the creation of the Community Care Collaborative, which the medical school as well as Seton, our partner, participate. And the goal there is to develop a coordinated and connected way of providing care. And again, the medical school brings tremendous talent and resource as we develop this new system of care. We will make the safety net more effective and bring needed advancements in care to the patients that are served by Central Health. Central Health remains committed to the residents of Travis County to create access to health care and to ensure that local taxpayers receive good value for their investment. We value and encourage the community's ongoing support so that our neighbors, friends, and families, as well as coming generations of Central Texans, will have access to care that's needed. Thank you. And it is my pleasure to introduce a friend of mine, a servant of this community who has served in multiple capacities, but now serve as Travis County Judge Sarah Eckhardt.
Well, good morning. I'm going to try and speak over the crash of construction, which is mighty nice. Last night I was reading the backup for the Travis County Commissioners Court on Tuesday.
And the Community Action Network dashboard of indicators is part of our backup because they are doing a presentation. How many of y'all have ever looked at the Community Action Network's dashboard of indicators? Yeah, this is a crowd who would know about that, right? Well, we've made some real progress. We are, on balance, a pretty healthy community, all things considered, on average. And because of Obamacare, we've also made some real progress on the numbers of individuals who are insured. We have only now 20% of our population that is uninsured. But of course, we have some real work to do. We need to rethink why so many people in our community are suffering with mental health disorders and how we are going to turn that around. And we need to rethink why so many of our most vulnerable residents are struggling with obesity and diabetes and how we are going to turn that around. We need to rethink why so many of our most vulnerable residents are in jail with mental and physical disease and how we are going to turn that around. And we need to rethink why, in one of the wealthiest communities in the nation, we have more uninsured residents than the national average. And that's where academic medicine is going to help us tremendously. This is the challenge of academic medicine: to train up doctors who are compelled to walk into the communities of the most vulnerable and to rethink why and how we are going to change it, to truly move the needle, to be innovative, effective, efficient, and fair. This is an incredible opportunity for us. This is an opportunity for us to be the community that we want to be the community that we think of ourselves as being. But to change the numbers that we see in that Community Action Network dashboard, those persistent numbers that we can't seem to figure out, we've got to rethink those numbers. And I am very, very excited about this partnership. I'm excited that our community is committed to this partnership, and I look forward to asking those hard questions right along with Dean Johnston. Why and how are we going to change it? And with that, I'd love to hear the Dean's closing remarks.
So thank you very much. Those were all wonderful presentations. You know, excuse me for being a little grandiose, but during the Renaissance in Florence, a bunch of really creative people came together and they totally thought differently about what art really was about. And they completely changed the landscape of art and literature as well, although we think about art and architecture. We have a similar kind of opportunity here. We have wonderful people that we brought together. We have a vision. We're bringing more and more great leaders. We're not great artists, but I do think we have an opportunity to create that kind of innovative nexus that was represented in Florence, but now about health. So yes, this is an opportunity to rethink everything. And really together, I believe we can revolutionize the way people get and stay healthy, but only with all of you. So thank you very much.